Hi all. Today we are going to discuss about a very important topic for biochemistry in basic sciences. This video is for general surgery residents who are appearing for further university exams. So I want to uh, completely upload the videos of basic sciences in each separate day titles. Today I will emphasize the importance of 5 points for each questions, so that it will be easy for you to answer in your exams. So the first question is phospholipids. Let's move on. So phospholipids. So the phospholipids, the very important key things. It's a fatty acid plus alcohol. So phospholipids is fatty acid plus alcohol. So keep in this mind, phospholipid. So it's mainly for your cell membrane. Okay. So the first point we have to remember is carbohydrate, protein, and phosphoric acid. So phospholipid is fatty acid plus alcohol. Alcohol is two things, either glycerol or even sphingolipids, phosphate plus nitrogenous base. So lipid, once again, phosphoric acid and nitrogenous base. So it is divided into two groups. One is glycerophospholipid and sphingophospholipid. Glycerol, sphingosine. Lecithin or cardiolipin is the base of phospholipid. So glycerophospholipid, just understand the example. Lecithin, cardiolipin. Sphingophospholipid, sphingomyelin. So we know myelin is mainly predominantly in your nerve sheath. Cardiolipin is present in your heart. So just remember these 5 points. Then acute intermittent porphyria. I want you to understand a basic thing. Acute intermittent porphyria. So it is acute. How it will present? It's an abdominal pain plus hematuria. Patient on exposure to sunlight. So keep these two things in mind. How does it happen? It's an inborn error of metabolism, the enzyme deficiency, which is hydroxymethylbilin synthase, parfobilinogen. So what is happening? The accumulation of parfobilinogen because of deficiency of HMB synthase or PBG deaminase. So because of this, parfobilinogen accumulate in your blood and excreted in the urine. So initially the urine is colorless. On exposure to sunlight it becomes darker. So this is very important. These colorless compound, the urine is colorless when watered, but darkness on exposure to sunlight because of the photooxidation. So it is an autosomal. See, any enzyme deficiency we have to think of autosomal recessive inheritance, but now it is autosomal dominant inheritance. Major symptom, abdominal pain, neuropsychiatric symptoms. Second, electrophoresis. So electrophoresis, what do you mean by electrophoresis? See, electrophoresis is nothing but the charged particles movement, right? So it's migration of the charged particles in a porous support medium in the presence of an electric field. So if you are making right here, if you are keeping right here positive charge, here negative charge, here neutral solution is present. So if you activate this, the negative charges will go towards this side and the positive charges will go towards this side. So this is what the migration of charged particles. So as I said, the positively charged particle will move to the negative cathode and negative charged particle move to the positive anode. The separation of protein in the blood, widely used for separation of proteins in blood. We know the albumin is negatively charged. So in this manner it will be useful. The plasma proteins including immunoglobulins, lipoprotein, isoenzymes and nucleic acid. So we know the one point I want you to remember, immunoglobulin electrophoresis. So it's a very important test. We know the IgG4 gamma disease, as this one is a very important phenomena. We can able to analyze all the immunoglobulins pattern. There are multiple types. Just remember this mnemonic, HZIC, which is high voltage electrophoresis, zone, capillary, immunoelectrophoresis. Just remember this mnemonic, HZIC, right? Next, what is the role of cellulose? So it's only in plants, a dietary fiber. So we know cellulose is a dietary fiber. So it is not digestible understand. So it is present in plants, absent in animals, right? So it's an unbranched, a linear polymer. So it's anything is a linear which is unbranched. And now, so any sugars must have a beta glucose chains. So they are connected by a glycosidic bonds. That's how. So these are hydrogen bonds which are cross linkage. The structure of cellulose is strengthened by hydrogen bonds with extensive cross bridging. So we know cellulose is a non-digestible in humans. Then how come in it is digested? It is digested by beta amylase, a cellobiose, and from there it is converted to a linear polymer, a linear monomeric form, which is a beta D glucose. So humans cannot digest because they can't able to cleave this beta glycosidic bonds. So understand these 4 points. Cellulose is a dietary fiber, a non-digestible polymer, and it is beta glycosidic bond where humans cannot digest, right? Now, so it is a multiple molecular catalyzing. So what do you mean by isoenzymes? So just understand these 2 points. Isoenzymes, these are multiple molecules catalyzing the same reaction. For example, lactate dehydrogenase. We are having 5 types of lactate dehydrogenase, but they are going to have a same reaction, but they differ in their physical and chemical properties. So isoenzyme variants like salivary amylase and pancreatic amylase. Creatinine kinase CK1, 2, 3. For example, 1 for brain, 2 is for heart, 3 is for muscle. Just understand this. There are many facts with respect to biochem. Just understand this. So now, so there are 2 enzymes we are going to discuss with isoenzymes: creatinine kinase, lactate dehydrogenase, amylase. As I said, creatinine kinase 3 forms, lactate dehydrogenase 5 forms, amylase 2 forms. That is salivary amylase and pancreatic amylase. Creatinine kinase 1, 2, 3, which is in our brain, heart, and muscle. Lactate dehydrogenase, there are 5 forms. So these 5 forms, just understand this point. LDH1 is in heart, LDH5 is in muscle, LDH3 is in your brain, and 2 is RBC, 4 is in liver. I know it is difficult to remember, but I want you to repeatedly see this video in 1.5x format so that you can able to have this. Then a very important thing, isoenzymes are oligomeric, okay? And this lactate dehydrogenase, which is what is the enzyme reaction? Lactic acid converted to pyruvic acid, where your H plus ions are utilized, and the resultant product is NADH, not NADPH, right? And now these are very important. Another question, mucopolysaccharide or MPS. So what do you mean by mucopolysaccharide? See, remember this, polysaccharides. Saccharides are sugars. So I am having a complex sugar which is having a repeating forms. So how does it occurs? Amino sugars. So they are having amino sugars. So sugars, either glucose or it may be a galactose, right? So I am having an amine. So there is an amine, glucose or galactosamine, right? Uronic acid, the same. So either instead of amine, I am having uronic acid components that forms glucouronic and idouronic acid. So what are all the major glycosaminoglycans? So then just remember this: disaccharide, amino sugar plus uronic acid, glucosamine, galactosamine, glucouronic acid and idouronic acid. So another examples. What are the major glycosaminoglycans? Hyaluronic acid, chondroitin sulfate, keratin sulfate, heparin and dermatin sulfate. Just remember this: hyaluronic synovial fluid, chondroitin cartilage, keratin cornea, heparin sulfate we know it is in our body, dermatin derma skin, right? And these are complex structures. So just remember these 5 points. Now these are polyunsaturated fatty acids. So we know the polyunsaturated fatty acids, they have to be taken in your diet, right? And what do you mean by this? Polyunsaturated. So unsaturated, they are having no double bonds beyond the 9th carbon atom. So beyond the 9th carbon atom, they don't have any double bonds. So what are they? Linoleic acid. We know we often prescribe evening primrose oil, a fibrocystic disease of breast, right? So this is a polyunsaturated fatty acid. Now arachidonic acid, we know arachidonic acid is a precursor for prostaglandin synthesis. It's a semi-essential fatty acid. It can be synthesized in our body. So that's how we feel the pain. Only linoleic and linolenic cannot be synthesized, right? Because you can't able to introduce a double bond beyond the carbon 9. So if this polyunsaturated fatty acid deficiency is present, patient will have phrenoderma and scaly dermatitis. So what do you mean by phrenoderma? It's like a toad skin. It's like the skin of a frog, where you can't there will be like you will have multiple scales like that. So what are the ketone bodies we have in our the next question is ketone bodies. The ketone bodies are synthesized in liver mitochondria. We know mitochondria is the powerhouse. Okay, so in that case, if your glucose is lost, next your fat, next your protein, next your ketone. So my mitochondria gives ketone body for me to get energy, right? So in that case, acetone, acetoacetate, beta hydroxybutyrate, these are three important ketone bodies. So how does it form? Acetyl CoA, acetoacetyl CoA combines to form acetoacetyl CoA to form HMG CoA. From there, acetoacetate plus acetyl CoA lies, and then it is divided into acetone plus beta hydroxybutyrate. So just keep one thing in mind. This beta hydroxybutyrate is not detected in your urine dipstick. Okay, acetone is the only detected in your urine dipstick. Okay, so the first ketone to produce is beta hydroxybutyrate. HMG CoA is a precursor for your cholesterol and ketone body synthesis, right? So as I said, both acetoacetate and beta hydroxybutyrate are strong acids. They they lower the blood pH. But what is happening is beta hydroxybutyrate is not detected in your urine. Only the urine acetone is detected, right? So this is very important, and this is known as ketoacidosis, right? So now we are going to discuss about an important question called mutations. Just remember this. What do you mean by mutations? Alteration in the nucleotide sequence. It's not nucleoside, it is nucleotide sequences in the DNA. This is known as mutation. So now, if something has to induce mutation, so what are they? Mutagens. So like your UV radiation, your diet, genetics, hereditary, everything are mutagens. So what is the changes happening in your DNA? Replication, transcription, translation. So just classify this: point mutation, frame shift mutation. What do you mean by frame shift? For example, you are having 1, 2, 3, 4. We all appear for PG Chandigarh exam, right? So if I am going to answer this question, mistakenly I didn't answer this question, and for the next question I am marking this option, and all the options will get wrong. And this is what frame shift mutation: insertion or deletion, point mutation. Exactly at a point, for example CGAT. Now if the mutation happens, for instead of CT, these are nucleosides, I am saying about that. If it happens, then it is point mutation. So what do you mean by hybridomas? So now we are going to discuss about hybridomas, which the image can be tilted in a separate, in the last image, injecting a mouse with an antigen. For example, the mouse is having AB. Okay, so I am injecting a G, which is an antigen. So now it will produce an antibody G dash. So that provokes an immune response. The WBC of mouse will produce this antibody in response to the injected antigen, which is your G. So antibody from the mouse, that is your G dash, is then fused with a B cell. For example, G dash is for your myeloma cells G. So now it will produce an antibody that is called as hybridoma. As I said, antigen, mouse cell. This is antibody produced, which is your G dash, and fused with the B cells, cancer cells, and for hybridoma. For example, see, this is your antigen, that is your B cell, myeloma cell, right? And antibody produced is in this cell. Okay, so now we can fuse it, and that is called hybridoma. So where I can use it? A quantitative preparation, a quantitative preparation of pure antigens, or even diagnosis of leprosy. Just understand these 5 points. Now, there is one thing called permeability. What do you mean by this? Urea clearance. Yeah, this is what I said. Hybridoma, most challenged with antigen, and then spleen cells, myeloma cells, and fusion, harvesting the monoclonal antibodies from them. They culture in HAT mediums, select for positive cells, right? And just understand this. I think this was the one question asked where I can also use this urine concentration test, urine acidification test, and analysis of blood serum, and complete urine analysis, and after glomerular filtration like urea clearance. So what do you mean by urea clearance? Just understand this point. Urea clearance is defined as the volume of plasma. You are having the plasma, it is cleared of the urea per minute. So it is urea into V by P. The volume of plasma is cleared of urea. Okay, and that is what called as urea clearance. I hope you enjoyed this video. Thank you.